I'm very excited about this chance to tell you what we've been doing during COVID and to thank you. It's always about participant appreciation and to thank you for all your contributions. So in the next slide, I wanted to review for you the timeline of what it's been like for our ADRC here in New York City, one of the hardest hit places during this time of COVID. And just to have you just take a moment and think with me about what it's been like and how far we've come. I don't know if you recall, but back on March 15th, we had all in-person research stopped. And at our sites, only our frontline staff were coming in and everyone else was working remotely. In New York City, we were really dealing with the spread of COVID-19. For those of you who live near the hospital, you may remember we had tents set up in the Central Park to handle the great number of cases. Every day we heard about new and growing numbers. But the ADRC was really eager to be in touch with everyone and to keep the important mission of research for Alzheimer's disease going. So by March 23rd, our ADRC was preparing to continue their work from home. That's within a week of this shutdown. We had to create digital data collection tools. We had to learn how to use secure methods to contact all of you. And by March 26th, we had actually really begun remote assessment. We had the first one completed thanks to many of our coordinators and staff. And so I'm going to tell you about some of our experiences. And today we have nearly 100 completed. That's so impressive. It means both sides of this process, everybody in the ADRC and all of our participants have been really working hard to join us to keep the important work of Alzheimer's going. So on the next slide, I just want to summarize some of the challenges. First of all, we wanted to figure out how to reach you. And this was a real challenge because many people were calling from home. They may have been calling from a new number or from their cell. So you, our participants, our partners, you didn't know who was calling. You didn't know where we were calling from. You didn't know what we wanted. And we didn't know what you wanted and what you needed. And so that was a real challenge to help us move forward. In addition, we had to create a way to do all remote assessment. What that means is all those papers and test tubes that we brought into you when you came into us were gone. We had to prepare to do all of our assessments by a phone call. And then we had to help you find a place to do those assessments, helping you think about the fact that you needed a quiet place and you had to avoid interruptions. Imagine how difficult, given that everybody was staying home, you probably had extra people in your places, you had your dogs to take care of, your pets, and yet we had to find a place where you could come and prepare to do this assessment remotely and in a quiet place. Then we had the challenge of sharing the data. You know, research is really all about sharing the information. We use something called VPN for security. That's a virtual network that allows us to communicate just as if we were on the same security systems that we have inside the hospital. We had to figure out how to schedule the doctor call. Remember, when you come to our visits, you often see the tester, the coordinator, and then you go to the next room and you see the doctor. Well, that didn't happen, so we had to find a new way to do it. Then we had to find a way to store all that information safely so we could get to it when we needed it. And then, as you know, the process isn't over when you've had your assessment. But we get the team together to conduct a consensus and to review how you've done, looking at all of the different parts. So we had to create those remote teams. And we had to share the data with all of our experts, the neuropsychologist, the doctor, the coordinator. And then we had to figure out a way to get the results to you. So these are all just some of the many steps we had to go through. And you helped us all along the way. So on the next slide, one of the big challenges that we managed to handle right away is we had to create a way to do the research remotely. And what you can see is what we usually did is paper forms. We had something we'd ask you to write on. We would read from something. We'd write down your answers. But now we didn't have that paper. We were in our homes and we had to figure out what to do. And so Yoni gets, this is Jonathan Greenberg, one of our most important coordinators, has helped us convert all of these forms to a form that allows us to collect the information on our computer and share it via the computer, and really eliminated all of this paper packets. And in the next slide, and so as I said, the remote testing was a real challenge. And I want to thank Nellie Velasco, who really managed to get everyone ready for the phone testing. It means explaining to you what's going to happen and then explaining to the coordinators what we needed to do it right. And I'm happy to say this was really well received. In one of our recent assessments, we had a very nice quote from one of our participants who said, "This is very convenient and comfortable experience. I love that there was no travel involved and it made me feel safe." Imagine being able to keep us connected during this really challenging time. Next slide. So are we ready to come back? This is a big question. We have new protocols for all of our in-person assessments, and the particular assessments that really need special protocols are those times that we collect biomarkers, whether it's blood or whether it's imaging, things where we can't do it remotely, we really need to do it in person. And we've put in place many new protocols. We have pre-screening for symptoms. Someone calls you and asks you about your symptoms. We have temperature checks at the door. We've been putting more time between each participant so that the centers can clean after every use. We have social distancing in the waiting room. People are often waiting outside until it's really just time for this to happen. Well, just last week, one of our participants tried it out, and we asked them, are they comfortable coming to the scanner? Well, what you can see is it was a resounding success. We were told they were totally comfortable, absolutely felt that the staff had taken every necessary precaution to ensure safety. It was delightful. Everyone was so nice. So there's two things I like to remind you of. We've been working really hard to make sure you'll feel safe when you come back. But another really important thing is I think many of you were excited about joining us, and I want to thank you. Faye was one of the people, Faye Shepard, who's pictured here, was one of the people who was helping us coordinate this. And in a few minutes, we'll have a chance to talk with Dr. Hayden and his team who got the first scans collected. But I want to say I'm really proud of the team because there's a lot of steps and we really moved forward. And I'm so proud of our participants because they were eager and excited enough to come back and join us. So one of the things we've really learned during this period is it's important to listen to you, to hear what you have to say, and to see how we can better serve the research questions that are going to be important to you. So when listening to our participants, one of the things we found is not everybody was excited about doing remote visits. Many of you were, about 80% said, yeah, I'm ready. I would love to have a remote visit. But almost 20% of you said, you know, I want to wait. I'm not sure. These were really incredible times. We were worried about safety. We're distracted by the news every day, giving us new numbers, always seeming to escalate. And many of you wanted to share your COVID-19 experiences with us. Tell us what you were going through. See how we can share what worries and anxieties are created by this really epic moment. So to serve these needs, we created the COVID survey. So with your help, we created a survey to learn how COVID was affecting you. And one of the things that we were excited about was that we were able to ask all of our participants, even if it was not your time to do the assessment, or even if you said, I really don't want to do the testing on the phone. And your contributions will be showcased at our National Alzheimer's Disease Center virtual meeting in October, because we've had so many responses, many more than a lot of our colleagues. In fact, we helped them shape this survey because we were able to get your input on what was important and what's the right way to ask the question. And so I'm going to take a moment here to insert a poll question.
All right,
Maria.
so everyone I'm going to see a poll that's going to present on their screen. You can use your mouse to click the answer and hit submit.
Tick, tick, tick. Hopefully you'll all try to answer and click the right number on your screen. This is the first time for us.
Oh, look, we can see people's answers.
Because you're...
Or is it just me that can see them?
I think so.
Oh. And you know, we understand if you're on the phone with us this morning, you won't be able to participate in this. But again, we'd love to hear if you want to drop us an email or a phone call, you know, what your experience was with the virtual ADRC visit. We would love to hear your feedback about it.
All right.
Maria, is that about it for everybody?
I think we're about halfway.
Okay.
We'll give you another few seconds.
Yeah.
All you need to do is take your mouse and click on it.
Okay, I think that's
Good.
okay.
Okay.
All right.
So now I'm going to tell you a little bit about what you told us during the COVID survey. I think it's really important. You know, one of the things that we've always said at the ADRC is we want to share back with you the information that we've gathered. So first of all, we found that about 31% of you have reported being tested for COVID-19. And about 10% have been tested or positive. If you remember in the beginning, we didn't even have tests. So some of you were determined to be positive in the absence of the test. And about 25% of you have been tested for antibodies. And among that group, about 6% have been positive for antibodies. So that's relatively important information to realize we are participating in gathering this information for ourselves and for our city. This will be very important. There's a couple of takeaways, though, that I think are really interesting. We had really low numbers of those with COVID-19 in a very high-risk group. The question is why? So in the next slide, I want to show you what we found out about what you know about mitigating strategies. Those are the strategies that we use to reduce the risk of transmission. What you can see is that 100% of you were trying to practice social distancing. 98% were wearing masks. 97% knew about hand washing. And you were all avoiding social gatherings. So maybe these good practices observed by so many of our ADRC members is one of the reasons why we had such low numbers. Let's keep up the good work and continue those efforts. We found other things as well. So here are a few more questions I want you to hear about. How is COVID affecting you? We asked the question, how worried are you that you will get COVID, or if you previously were infected, that you'll get it again? And about 40% of you said you were at least somewhat worried. How isolated are you? Are you feeling during this COVID pandemic? And 36% said you were at least somewhat isolated. And since the start of COVID, how often have you felt that you are unable to control the important things in your life? And about 36% of you said you feel as though you are unable to control important things at least some of the time. So in the next slide, so since the beginning of the pandemic, we asked, have you been worrying about friends and family becoming ill or experiencing death of a friend or family member due to COVID? And about More than a third of you experienced a death of a friend or family member. That's quite a significant amount of loss in a short period of time. In addition, about 70% of you acknowledged worrying about becoming ill.
Dr. Sano, hi. I'm just checking in. I think maybe you're having a little bit of a trouble with your connection over there. I'm not sure if there's anything that.
All right, I'm closer. Does that help?
It helps. Sounds good right now. Great.
Great. I'm going to lean in and see if I can tell you some more information. Okay, so since the beginning of the pandemic, we asked, are you worried about financial loss or experiencing worry about stigma? And here our numbers are low. Many of you reported that you were retired, and the financial loss was not your primary issue. Only a quarter of you mentioned that. And stigma was also low. I think that's an important observation. And in the next slide, you asked us specifically to separate out the words anxiety and depression, and that was an important request. So, for example, we found that about 50% of you reported having anxiety about this pandemic, and only about 17% characterized it as depression. So, given these concerns, in our next slide, given these concerns, I am really excited to tell you that we had a great opportunity to work with Shahan Chin, our social worker in the ADRC, and she came up with some really important approaches to answering these kind of worries. So Shahan, I'm going to ask you to walk us through some of the things that you've learned and shared with our participants.
Sure, thank you so much. Hi everyone, thank you for joining today. I am the social worker at the ADRC and my name is Shahan Chin. Our social work program is privately funded and provides research partners and caregivers with information, resources, and support. This includes tools and strategies to encourage, promote, and maximize self-care. Our focus is to help caregivers to actively and intentionally take care of themselves first. So during each of my meetings and my work with participants of this program, a self-care action plan with personalized resources is prepared for each individual. It is a working document and it is continuously reviewed and revised as personal and family situations change. So during this pandemic, the action plan was actually revised and edited to include a safety plan for caregivers to be able to take care of themselves as well as taking care of their loved ones. The top concern during this period of time that participants have expressed to me was personal safety as well as keeping their loved ones safe. And the plan was updated with relevant information to focus on COVID-19. So you have things like adopting new behaviors. We want to wash our hands more frequently. We want to wear a face mask, practicing social distancing, talking about when to quarantine, talking about what to do if someone in the home becomes exposed. Another part of the plan is to help members stay connected to their loved ones, their friends, their families, as well as outside organizations. Especially during this time, we have to practice social distancing, which has been actually a bit confusing because it can feel like social isolation. However, we do want to point out that these things are not the same. Social distancing and social isolation are not the same. Social distancing only changes the way in which we typically interact with one another. We can still stay connected through phone, video, and even writing letters. It just means we have to be distanced. Staying connected is an important part of emotional wellness, and it is important to prioritize, especially during this period of uncertainty. So creating a plan to connect becomes a top priority, and it aids to decrease the ramifications of social distancing and the risk of depression and anxiety. The plan also includes a review of basic needs. So for example, having a list of your medications. We want you to have an updated list of medications. We want you to share it to members so that they also, we want you to share it to family members so that they also know and are aware. We want to make sure that the house is well stocked with at least 2 weeks of supplies. So food, water, household cleaning supplies, make sure you have enough of them at home. And part of the plan during this period of time is also identifying, helping the caregiver identify a backup care person should the primary caretaker become ill and need to self-quarantine. We recommend staying in an open and honest conversation with that individual or individuals. So during this period of time, I've actually been connecting more frequently with all of my participants. And as COVID restrictions change and personal, family, and personal situations change, we will continue to review and revise the plan so that we can continue supporting our caregivers. These are just a few highlights of specific issues that have been going on and what has been going on during this moment, what I've been working on with my participants. I can clarify and speak more about specific topics during our question and answer portion. For now, I think I'm going to just hand it back to Dr. Sano. Thank you so much, Dr. Sano.
Hi, everybody. I think Dr. Sano, we could all tell she was having a little bit of connectivity issues. Welcome to Zoom land. This is the world we live in right now, and I think that she is reconnecting through her phone, so maybe we'll be able to hear a little more consistently.
Yes.
Great.
So what I wanted to do in this next session is talk to you about some of the most recent data that we've been hearing about. And I'm sure you've been getting a lot of information about the most recent clinical trials on aducanumab. Two very large clinical trials entitled Emerge and Engage were reported out last December and again at our meetings at AAIC. And some of you may have been participants as we were involved in the Emerge study. Although both studies are identical, they had very different results, and I want to summarize those differences for you. So what you can see on this slide is an overall description. This was a 18-month study that's what we call phase 3. That's the study just before we try to bring a drug to market. In this study, we enrolled individuals who had early Alzheimer's disease or who had mild cognitive impairment. And all of the people who were actually enrolled had positive scans on amyloid. That is, they had positive amyloid testing. And this study included a placebo and 2 comparison groups, a high dose and a low dose. And the primary outcome was something called the CDR sum of boxes. If you recall, many of you know the CDR, the clinical dementia rating. It's that test in which we ask both you and your study partner questions to come to an answer. There were many other outcomes. In particular, one of the important outcomes was to see, do these drugs actually lower amyloid? So in the next slide, what you can see is the results of amyloid lowering in both studies. The top line is the placebo line, and I'm gonna that's it, great. On both studies, you can see that the individuals who have amyloid show no deterioration in their amyloid over time. But both the high dose and the low dose group in both studies had a lowering of their amyloid. In fact, some might say, particularly in both studies, that they lowered to pre-disease levels. So we were able to lower amyloid in both studies. But the important question is, does lowering amyloid have an effect on our clinical status? And in the next slide, we can compare those results. Now here, the line is showing worsening, so increased worsening, and again, that gray line is the placebo. And what you can see is at the 78-week time point on the EMERGE study in the left, we saw individuals with high-dose aducanumab were performing less poorly. They did not have as much deterioration as the individuals who were in the placebo group. All right. However, in the very same study, on the other side of our picture, what you can see is there is no separation of the groups. And so what we have is one positive and one negative study. And there's a big controversy in the field. Do we think one is right and one is wrong? Really, we don't know the answer. And so the question is, do we approve a drug with only one positive and one negative study? Or should we do another study to tell us the definitive answer? I think that's a really important question, and the FDA will be taking it up over the next 6 months. All right, so that's one very important area that we're focusing on, but there are other areas, and I just wanted to take a minute to tell you, I'm sure you've all been reading about the Nude blood tests that may either predict Alzheimer's disease or help us diagnose it. Many of you have participated in our supplemental blood collection studies in which we look at different proteins in the blood. And I think it's important to share with you how important these results are. For example, we need to know, does the blood test match up with the results of the data we get from the very expensive and time-consuming imaging studies? Does it match up with the results we get from measuring amyloid and proteins like tau in our spinal fluid tests, which are also time-consuming and often uncomfortable? However, the promise of these tests is to allow us to have more information to identify the biology that might underlie the different types of cognitive impairment that individuals are having. And I will say there's quite a bit of information on this. Different, what we call platforms, have been used to measure the proteins, and results differ slightly. In our validation samples are different sizes in different places. So two big challenges, once we decide on the best test, is to find out how can we give it to the largest number of people. We know already, even something as hopefully precise as COVID testing, it's been hard to get that test out to everyone. Imagine how difficult it'll be to translate this one as well. But also will be important is to know which is the protein that marks the biology, which is the protein that marks the performance or the cognition. And so I think that we have great hope here with these tests, and we're continuing to do a lot of work. And what I've done is I've left you this link. This is an incredibly reliable source. Very little fake news here. This is the NIH website that where you can go to hear about the most up-to-date results in blood testing and other research findings. So with that, I'm going to end my talk, and I'll give it back to Dr. Sewell, who will tell us what's next.